네, 먼저 대구시에서 적극적으로 유치 제안을 했고요. 또 유치 전에 직접 외국의 주요 멤버들이 대구를 방문을 하시고 그 지원이라든가 인프라를 보고 굉장히 감명을 많이 받으셨습니다. 그래서 실질적으로 유치 경쟁을 호주의 브리스번하고 UAE의 아부다비 그리고 대구가 붙었는데 여러 가지 인프라 지원 조건 그런 것들이 대구가 가장 우수한 점수를 받았고요. 많은 호평을 받았습니다. 앞으로 해외 학회 유치를 계획하고 계신다면은 대구 컨벤션 뷰로와 하신다면은 A부터 Z까지 다 도움을 받으실 수 있고 확률 100%로 유치 성공할 것으로 확신합니다.
Welcome everyone to 2021 Korea Medical and Wellness Tourism Fair Medical and Wellness Conference. The second session of the conference is Korea's top 5 new areas for medical tourism promotion, and I am Won Hyun-jung, your MC for the conference following yesterday. And the 5 areas are preventive medicine, medical checkup, obstetrics and gynecology, and ophthalmology, and traditional medicine as a focal marketing targets. And we will invite experts for each clinical area to talk about current status and future direction of Korea's medical industry. The COVID has brought significant challenges and changes to medical industry, and today we will have an opportunity to take a look at the 5 areas newly selected for medical tourism promotion in terms of how patients are treated through which system and technologies, and what development potentials they have in attracting foreign patients. Now let us start the session 2 of the conference to know about the 5 areas. The first is preventive medicine. The speaker will be Professor Ko Sang-baek from Yonsei University Wonju College of Medicine Preventive Medicine Center. And the professor will share with us the current status of Korean medical technology and its position and impact in a global context. And we will meet the speaker through a video.
안녕하십니까. 연세대학교 고상백 교수입니다. 한국관광공사에서 실시하는 컨퍼런스에서 발표할 수 있게 되어서 무한하게 기쁘게
Good morning, good afternoon, good evening. I am Professor Ko Sang-baek from Yonsei University, and it's my delight and honor to talk on the conference organized and hosted by Korean Tourism Organization. And my topic today is preventive medicine, technology, and digital health. The medical paradigm has been shifting. In the past, it was about empirical medicine based on symptoms, but the modern times is about evidence-based medicine. But in the future, it will be about precision medicine based on data. And the future technologies include omics technology based on genomes and big data and ICT-based medical technologies. The paradigm shift of medical service is from a service that treats to a preventive service that reflects the personal characteristics. So preventive medicine will become very, very important. In order to provide personalized medical service, we have to think about personalized service based on IoT and big data-based personalized service. So we call this area P4 medicine, predictive medicine, preventive medicine, and the third P is participatory medicine, and the final P is for personalized medicine. So far, medicine was all about one-way interaction where patients just receive the medical service given by the doctors and nurses, and it was only about treating the symptoms. But the future medicine will focus on the prediction and prevention, as well as the wellness and increasing the health. And it also includes healthy people, not just patients, so that they can provide personalized services that can fit the individual situation. And right at the center of such shift, digital health plays a very important role. Digital health or digital healthcare, both of the words are used, and it is different from mobile health or e-healthcare, but sometimes they get used interchangeably quite often. But the WHO released a new guideline in 2019, and they call this digital health. So digital health uses digital technology, and it is about medical service and medical devices. So it's a very comprehensive concept, and it's also based on genomics, big data, and AI technologies. And all of these areas are intermingled together with the symptoms and other elements of medicine. And it is an expertise and specialized area. Korean government, the IoT, with IoT, big data, and cloud internet and cloud computing, all of these technologies are being used by the Korean government to provide personalized service and treatment. That's how they see the concept of digital health. Digital health as is shown on the presentation, covers new 11 areas. And with the development of digital technologies, these areas are being more expanded even. And the 11 areas are health system management application and user mobile application, wearables, connected biometric sensors, smartphone cameras, and patient information collection tools or personal health record tool. So the most important element of digital health is data. We all create a lot of data, lifelog data, and the traditional medical data only accounts for 10%. But with the development of genomics, the genomics data accounts for 30%, and the data that accounts for the most part is health-related lifelog data that we create every day, and it's about behavior pattern and social and economic elements that accounts for 60% of the total data. And these data have taken sort of a backseat so far because there's some technical limit, but it became quantifiable with the development of technology and more usable and utilizable, expanding the scope of medical service. So these are the 150 leading companies in digital health, and they are acting in a very different areas, and they are growing day by day. Smartphones and wearable devices are also used as a digital health medical devices, and they are using the IoT technologies, and their role is getting expanded even more. And digital health also includes wearables or attachable or sometimes insert type things that are inserted to your body that interact with the environment surrounding you. And this measurement data is highly utilizable and useful because if you wear something, then these wearable devices can check and measure in a continuous and quantifiable manner the data or biosignal data that your body creates. And they're also an opportunity where you can get the data outside of hospital, and these data are all real time, which is most valuable. So not just your activity amount, the heartbeat or heart rate, ECG, your sleep pattern, and blood pressure, blood flow, blood sugar, and your brain wave, and your eye pressure, and your position, and menstruation. There are so many areas where we can collect and measure the medical data. This slide shows how you can measure sleep apnea symptoms. And there's also a case where you can use smartphone camera. And as you can see from the slide, in many different places, in many different occasions, starting from your meals or everyday routine, there are so many different cases. And this slide shows how the data measured at your home can go and get stored in a cloud. And the hospital, of course, can get access to those data for better utilization. It's part of telemedicine, but remote visual medical training is also possible as part of telemedicine technology. And now let me give you some empirical examples. Based on some local or regions, we built an autonomous system and digital companies provide wearable services, and
대사증후군 환자 중 당뇨 관리 사례를
a platform is
구체적으로
also built
말씀드리겠습니다.
to support companies, and the medical centers are also
실시간
interconnected
측정한
through this platform.
국민건강보험공단 자료를 연계하여
And
매드비즈
let
플랫폼을
me
통해
talk about a real
데이터를
case
저장하고
about a patient who suffers from
관리할 수 있는
metabolic
체계가
symptom.
갖추어져 있습니다.
And we connect the real-time
그동안
data
확보된
through a
자료를
platform called
기반으로 해서
MedBiz
대사증후군 환자 중에
from the patient, data from the patient and data from the HERA. And we can measure and quantify the data and compare the data among them. And based on the data that we secured, we developed a prediction model for diabetes occurrence based on this data from a patient suffering from a metabolic syndrome. And for those patients highly likely to develop diabetes, maybe we can use these devices you see on the slide, and we actually did. And using the devices, you can check the health situation, and you can see the results of the measurement and checkup through your smartphone. And you can also access to the data stored in the cloud through your smartphone. And this is the application interface that you see, that a patient sees through his or her smartphone. For example, you can see blood sugar, blood pressure, and your weight. And it can also manages your meals. So the data repeatedly collected and measured through the platform shows you how well you're managing your health. And it's the data, they're all stored in the MedBiz platform. And health professionals can see this. So based on these results, we send texts, the SMS, to the patients. And for the participants with low participation rates, maybe we can give some nudge or motivation. And this is the result of the comparison for 6 months for the participants. And you can see how their health is getting improved. Next example is empirical case, the second empirical case, which is about the COPD. So we have this device that can measure many things, including your organs or the air quality. And this is the device that can check the dust particulate or particulate matters. And we can also see how patients are exposed to how many particulates. And maybe increase of the PMs can directly lead to the worsening of your health. So that is going to be an effective management tool. And in order to improve the COPD management service, we have this architecture called Zoom. So this is the start display. You log in and you answer some survey questions, and then your data about your health can be integrated and in one platform. In everyday life, you feel something, for example, how well you feel and what is your mood. So you can type in and the health professionals can easily access the data. Through a platform of MedBiz, healthcare professionals can access this information, and through user application, a lot of information is collected, and it is designed as a dashboard interface. So it's really effective in letting the doctors have plans for the patients in the treatment. The third empirical example is health management biosignal monitoring service. In the hospital, you use the ECG to check the status or conditions of a patient's heart. We have Holter ECG and monitoring devices and 12-lead ECG. These are very basic medical devices. But with the development of digital medical devices, patients can easily be monitored even outside of their home or doing something outdoors. This is very effective in preventing heart diseases. And this is the case where we used an attachable ECG. And let me tell you about this case in detail. So we chose a target group of people who likes hiking or who likes walking. And this is the multi-user real-time monitoring platform. And doctors can see many patients at the same time. And this is an attachable ECG, and you see the photo how they attach the device. And you see the monitor where people's heartbeats and ECG data are being checked checked by the hospital personnel. So far, 2,000 people have been taken, and there was no emergency cases, and 314 people were recommended a hospital treatment. And out of 2,000 participants, well, this is the tracking course of 2,000 patients, 2,000 people taken to the survey. And let me go to the fourth example, LifeLog-based big data platform. We create so many healthcare data, so many genomics data, and LifeLog data. We create this data continuously, and the amount of the data is so big. To effectively use this data, however, you have to do the right measurement, and you have to store the data in the right place. And more than anything, we have to have the correct data and interpretation. And wearables and other devices secure the data, but other documents and traditional paperwork data also need to be integrated under one platform. So as you can see from this slide, there could be various types of data about one person's health condition, and you can see a quite comprehensive and a holistic approach to the one person's data management. And these data are accumulated real time and analyzed by the AI real time, and it's so effective in preventing and predicting the diseases. Integrating all the medical data is of course impossible realistically, but using a LifeLog big data platform, this might be possible, and this is underway. And based on the participation center, the platform will be built. Recently, to integrate various data, we are building a platform, and we're also looking to the AI for the effective analysis of such data. So in the ecosystem of IoT, smartphone will work as a data hub, and the data measured by digital health platform have to be transferred and stored through the smartphones. So Apple, Samsung, Google, and other companies related to smartphones are really focused on building a healthcare platform. And this is the LifeLog Big Data platform built by a public sector. So LifeLog Big Data platform secures and stores many continuous data which can be monitored real time and analyzed by the AI. Currently, as an approach, machine learning is used to analyze the AI, and the deep learning is also widely used among the machine learning technologies. Using the digital health technology, the healthcare data can be improved qualitatively and quantitatively. And with the data integrated under one platform, digital health will diagnose diseases and prevent and predict diseases, and the scope will get even bigger in the future. Using smartphones and smartwatch and the ECG that we get from the smartphones, you can diagnose many diseases. And by monitoring the data collected from the emergency, the ER and the intensive care unit, maybe the AI does the rest of the work in predicting and preventing the diseases. So real-time data can be collected and stored. And it's a good use for preventive and predictive medicine. This is the direction of development of digital health. So there are a lot of barriers still. The first one is regulation about digital health. And of course, we have to think about the safety of such technologies. And there's also an issue with personal information protection. And there should be some improvement or streamlining of these systems and institutions. But despite all those barriers, in the trend of expansion of chronic diseases and the aging population, digital health is probably the only way for the brighter future. And it can also contribute to the improved healthcare that caters to the needs of Korean population, more interested in their wellness and healthcare improvement. And this is also an area for additional added value in the future. So it's good for business too. So the healthcare system will move along with the trends of wellness, and it should be focused on community rather than big institutions or organizations or hospitals. So using the digital technology, we have to think about linking the community and the hospital under an organized system. For the development of digital health, we should have a balanced supply and demand. And more specifically, there will be increasing demand from aging population and some social issues emanating from the inequality. And there will be even new areas with new demands. And market should be more activated as a platform for businesses to present new opportunities. And for the success of digital health, platform should be the basic place to start. And it should be able to include as many people as possible. So in conclusion, having a good infrastructure is important while developing service model and having a good industrialization strategy. They all are important strategies. And thank you very much for your attention.
Thank you very much for the presentation, Professor. And it was time to get to know about preventive medicine of Korea in its future direction and current status. Next presentation is about current status and future direction of medical checkup of Korea. We will invite Professor Chung So-hee from the SNU Hospital Gangnam Center.
Hello everyone. My name is Chung So-hee from Seoul National University Hospital Healthcare System Gangnam Center. Today I will talk about the current status of the medical checkup system in Korea and its prospect. This is the table of content. When we say medical checkup, it is defined by WHO and two other laws in Korea. So medical checkup means that we run tests on patients with no symptoms. So from the establishment of the Korean government until 1977, there was the first stage of medical checkup system in Korea, and the second stage was from 1977 to 1995, and it has become a national institution. And the third stage was based on the enactment of the relevant law, and it was expanded to the national medical checkup. And from the middle of 2000 up until now, it is the fourth stage, and there was the Medical Health Checkup Act, which was established in 2008. And it is directly related to the current medical checkup system in Korea. So this is the current structure of a medical checkup. So we have the national checkup and private checkup. And in case of national checkup, we have checkups for infants and life cycle tests, and some of the checkups for students and soldiers. So it is executed by the national or local budget. And we also have a comprehensive medical checkup. And there is a growing demand for health checkup. So the medical checkup rate is about 77%. And the life cycle medical checkup was conducted for about 15 billion people, and there are numerous medical checkup centers in Korea. And this is the size of the market, and the revenue from medical checkup itself is about 3 trillion won, and the medical cost following the checkup is ranging from 4 trillion to 14 trillion. So this is the background of the market. So Korea achieved the economic development, so people's income grew together. So there is a growing demand. And insured revenue was not sufficient for hospitals, so hospitals wanted to generate uninsured revenue. And people have become increasingly interested in well-being, well-aging, well-dying, and health in general. And the government has promoted medical checkup and health in general for the people. And before, we focused on pathology, but there has been a paradigm shift toward the health science. So based on this background, the medical checkup market has grown in Korea. And medical checkup centers have become larger and sophisticated. So these are some cases in other countries. So in Korea, national checkup system is much bigger, and they also have a private checkup system which is called Human Doc, but they don't have a price competitiveness, so they have limited growth potential. In case of the United States, they have a limited national system, and they have a similar system in case of private checkup, but the price competitiveness is still a problem for the US. And in case of the UK, they have the national checkup system covered by NHS, and in case of a private checkup, covered by companies such as LifeScan, but they only offer minimal tests based on evidence-based medicine, so it is very limited. And now, let me talk about the globalization of the Korean medicine. So when we look at the global healthcare market, compared to other industries, the market size is very big, and with the emergence of convergence medical technologies, it is expanding continuously, and there is a much longer average lifespan, life expectancy for people. So there is a high interest, and it is a high added value industry. So there is a growing competition among countries for the market. So this is the number of foreign patients in Korea. So from 2009 up to 2019, the average growth rate was 23.5%, and the accumulated number of patients is about 2.7 million people. And China and the US and Japan send most of the patients. And internal medicine, plastic surgery, and dermatology are the most popular clinical departments. But for medical checkup, the ranking of the number of patients is different. So it starts with Russia, followed by China, US, Kazakhstan, and Mongolia. And attracting foreign patients is beneficial for revenue, and it also has a ripple effect because it can create more jobs. So this is the performance of large hospitals, and it takes up about 10% of the entire medical checkup revenue. So this is the plan for Korea medicine to enter the overseas market. So there is a high competition in Korea. So they would like to attract foreign patients. But to attract foreign patients, they need a hub hospital in the local market. So they have to expand the brand. That is why medical institutions and hospitals are entering the overseas market more and more. And this is the competitiveness of the Korean medicine. The medical technologies are one of the world's best in terms of most of the major surgery. And the price is very low. If we take Korea as 100, it is 338 for the US. And also, Korea is nearby major countries such as China, Japan, and Russia. And we also have a great medical staff and infrastructure. So this is the history of advancement into the overseas market. Before, the most of the activities were under the ODA program or missionary work. However, now we are witnessing more and more cases in private-public partnership. And the accumulated number of hospitals entering the overseas market is about 235. And in Asian countries, many countries specialized in plastic surgery and dermatology entered those markets. However, there will be a growing number of cases in other clinical departments as well. So my checkup center built a center in China, and we also operate a hospital in the UAE. And so in case of Sheikh Khalifa, so we worked on various neurology-related surgeries. So they are mostly severe disease. So there has been a dramatic increase in the number of surgery cases in those areas. And Seoul National University Hospital was selected to operate a hospital in Kuwait as well. The result of the UAE case was very successful. That we were the first hospital to be commissioned to operate a hospital in overseas. So it contributed to the image of Korea as a medical powerhouse, and it also generated national wealth. So there are cases of other hospitals. However, there are limitations. So there is a concentration in certain areas, and most of the size was very small. And there is only a few successful cases. And the market is still at an early stage, so there is no profit model. And we have to deal with legal difficulties and license-related issues. And we also have difficulties in networking in the local market. So we require the government support in these areas. And in 2009, the government selected the new growth engine. And in 2016, the government enacted the law to support Korean medical institutions entering the overseas market. So there have been various policies. And the government provides tax benefits for SMEs, and the government allows the medical advertisement, and the government runs a system to nurture professionals. And it also punishes illegal brokers. So we are expecting the job-creating effects, and also we would like to generate added value in the market. And global healthcare infrastructure will be reinforced with the help of government support. Now, let me talk about the medical checkup system in Korea, but I will take the example of my center. So at the center, we provide customized medical checkup service. We look at the age, gender, medical history in the family. So we provide a customized service for patients. And there is a professional staff who run the test themselves. And in case of cancer detection rate, the incidence rate in Korea is about 0.28%, and the detection rate is quite high at my center. And there are abnormality detected, and the detection rate is about 29%. So when we look at the research from the American Journal of Gastroenterology, and the recommended detection rate is much lower compared to our performance. So, and we run a research institute within the center, and we publish research outcome in a world-renowned journals. And even after the medical checkup, if we detect cancer, and before consulting the result, we notify that in advance, and we refer the patients to specialists. And this is the checkup program, and we have to look at the age and gender, but we integrate personal risk factor so that they can choose the optimal program. And these are the most common reasons of death in Korea. And we also integrate data on age group. So we reflect all this information in the guideline so that people can choose the best program for themselves. And other medical checkup centers have similar programs, I guess. But the medical checkup system is very well established in Korea compared to other countries. So let me give you some cases. So it was a 56-year-old male, and he never smoked, but he was diagnosed with lung cancer. So you can find pulmonary nodule. It was very small, but in the follow-up test, we could find that the nodule was growing, so he got surgery. And it is another case, but there was no symptom, but renal cancer was detected. And the same goes for breast cancer. There was no symptom, but we found a 0.8 centimeter nodule in ultrasonography, so she was treated. And it is the case of gastric cancer. So we conducted some mucosal dissection. And colorectal adenoma, it is a previous stage of cancer, so it was a preventive medicine case. And it is very common. And we also conducted a surgery on colorectal cancer. So although it is not an early diagnosis, we found some swelling inside the brain. So we ran MRI, and the MRI result found the tumor, and it was detected, and so the tumors were detected in brain and lung at the same time. And there were many cases of cardiovascular disease. So he had a chest pain, and we ran CT, and we found the cluttering on the left side. So the next day, it was an emergent case. So we ran a ultrasonography once again, and he got surgery as well. And this male patient had pain in the leg, and he was planning to get surgery on the spine, but we found abnormality in ABI result, and we found a cluttering in the nerve, so he got stent treatment. And we found brain aneurysm very early, so we could prevent a much severe case, which could have been possible. So now, let me talk about the hidden disease. So it is very common. So we diagnosed the patient with diabetes. So the patient was on a diet, and we commonly find diabetes which generated no symptoms before, and this is the cases of osteoporosis. So we could prevent fracture through medication. And medical checkups are not only for detection of disease, and it could be a motivation to manage people's health. So there are some cases as well. So in case of this patient, it was a 58-year-old male, and he's obese, had a very high blood sugar level. So we always talked about that he needed to lose weight. But in 2020, he succeeded in losing weight. He lost about 10 kilograms. And blood pressure became normal after that. And as you see, the blood sugar level has improved a lot. And the liver test showed much better results as well. So diagnosis and detection are meaningful, and prevention is meaningful as well. And it is also meaningful because it helped the patient manage the health more actively himself. And now let me talk about the paradigm shift in healthcare. There has been a changing trend in the sector. So now we are witnessing an aging society, and there is a growing demand for medical service. So they require customized medical service, and people prefer service for chronic disease. And in the past, the focus was hospital, but now consumers want actively manage their health. And after COVID-19, we are witnessing the growing cases of untapped medicine, and prevention and management are priority compared to the past. And even in the political sector, there is a deregulation in digital healthcare, and there is a expanding support for healthcare industry. And artificial intelligence and big data, these new technologies are adopted in medical services. And smart healthcare was adopted in the industry, so the medicine is combined with ICT technologies such as IoT, cloud computing, and big data and artificial intelligence. So we can monitor the health status in the real time, so we can provide customized medical services. And for example, Seoul National University Hospital and CJ developed the application to improve the diet of people, so they can record what they have eaten, and the data is linked to clinical indicators. And Apple released Health Kit. The health data could be analyzed through wearable devices, and the data could be sent to the hospital. And Mayo Clinic and Google have developed such services as well, and it will include various players such as pharmaceutical companies and communication companies as well. So smart healthcare will be expedited in the future. And there are limitations in terms of institution and legal arrangement. So there is a limitation for telemedicine, and it is hard to share data because it is personal information. The government is adopting regulation sandbox to allow some of these activities. And in the future, There will be many more experimental activities in the industry, and I hope to see those changes. And now let me talk about the prospect for medical checkup. This is the future of health checkup. So from teenagers to people in their 80s, they should be cared at the fair level. And smart and mobile healthcare are adopted, and personalized care and predictive care will be key in the future market. So we will focus more on these two types of care. So starting with the growth clinic for kids, we can provide diet management clinic for young people, and for the mid-aged people, we can manage their stress level and brain clinic and for senior citizens, we can provide healing programs. So this is the total healthcare for entire life cycle of the people. And smart and mobile healthcare, they have been actively adopted already, but after running a basic test, we can manage the health status. We can create avatar for individuals, and they can manage their diet, and they can consult with professionals through mobile healthcare technologies. And there is a biosignal program. So when they have wearable devices, they can collect data such as blood pressure on the device, and they can send such biosignal data to the hospital. And actually, in my center, we have the program to use the sensor to measure the blood pressure. So based on what people eat, they can see the changes in blood sugar level in the real time. So it is a very favorable program for people. So before we had one single type of medicine and care, but now we are shifting toward personalized medicine. So based on genetic type, there are different diet recommended for a certain group of people. And my center has built artificial intelligence-based diagnostic program, and we launched brain aging program, and we can analyze 60 areas in the brain in the three-dimensional section, and we can detect the potential dementia in people. And we combine AI with endoscopy, and by using AI image system, adenoma was detected, and the detection rate was about 86.7%. And in the future, AR and VR, they are already there in the medical field. And we use VR for rehabilitation programs. And we also treat burnout syndrome and autism through this kind of new technologies. And for MRI and endoscopy, we let patients experience VR first so that they can find out whether they can do it or not. And it will help other types of rehabilitation programs in the future. So there have been numerous changes, and so social, economic, political, and technological changes have been going on, and these changes will be accelerated in the future. So this is the end of my presentation. Thank you for your attention.
Yes, thank you very much for the presentation, Professor Chung So-hee. It was a valuable time to know more in detail about medical checkup industry of Korea. We just covered medical tourism and health checkups so far. And next, we will invite Ms. Lee Soo-jin, a team leader of International Cooperation Division at Seoul Women's Hospital, who will talk about the women and treatment and consulting and treatment.
Good morning, everyone. I am Lee Soo-jin from Seoul Women's Hospital International Cooperation Team, and my presentation is about medical tourism and the OBGYN clinical department. My name is Lee Soo-jin, and starting from 1999 to 2018, I worked as a nurse of the ward and also worked at International Cooperation Team and planning team at Jeil Hospital. And starting from 2018, I've been working at Seoul Women's Hospital of Ain Medical Foundation. And for 22 years, I worked at an OBGYN clinic, and I'm confident that I know more than anyone. And we cover wide variety of patients. And it opened in 1993, and it converted to Ain Medical Foundation in 2011, and we are certified by the Ministry of Health and Welfare, and we are graded as the first grade by the ministry. And our reputation precedes our name. And in 2022, we will be relocated in Incheon. Our hospital size will be upgraded too, offering bigger opportunities for the foreign inbound in tourists. And we will be at the center of entertainment and shopping, and very close to Incheon Airport, 40 minutes ride. And since we're at #1 women's college, women's hospital, we aim to be the Medi and Life Complex Mall, offering a lot of functions and shops too, where you can shop for the baby products, and where you can also enjoy movies and coffee. And as a woman myself, I want to talk about what women want. And that's the key for promoting the medical tourism. And I'd like to talk about focus. Focus is the thing that we have in pursuing this project, but focus stands for family, one-stop, cost, ubiquitous, and soon. So focus is the keyword of my presentation. The first one is family. So I am surrounded by my family. So where do you go to hospital? This is the question, and I see the family as a network. For example, if the hospital your mom goes to is good, then your mom can introduce the hospital to other family members, and all of them can be our clients. But as you can see here, women can play a central role. But before your sisters and brothers got married, they become a separate family because the wife of that family has a leading role in deciding everything. And mothers are also in charge of taking care of the health of her families, and that's why mothers have the key role. And flow is important. Everything has to move in one flow and one vibe, starting from planning of the care. And this care must have a continuity throughout the process, and all the process should be flowing like water flows in one direction. And next is cost. So anything good should be expensive enough. I mean, there's nothing that is cheap but good. So Well, anything to be good, there must be some loss for the seller. For example, you can either save the cost for labor force by hiring someone not good enough, but if you are willing to pay your money, you open your wallet for anything that's good and that has the money's worth. And this is the same as the hospital care. If it's good enough, then you are willing to pay for the care. And women are very sensitive, and mothers are sensitive about the health of their family members, and mothers will open their wallet if the care or service they get from the hospital is good enough. But maybe I can't speak for the millennial or Z generations, but I think they prioritize themselves more than anything. So they are also open. They will also open their wallets for the service and cares that are good enough, because that is a trend. And we have to keep up with the trend. So by providing the best care we can and setting the most reasonable price for the care and service that we provide, then I think it's going to work. And next is ubiquitous. Ubiquitous healthcare means remote healthcare, not limited by any spatial or temporal limit. So you can see your doctor anywhere, anytime. And I think it's an important factor in promoting medical tourism. And with the continuation of the COVID for more than a year, there is a certain gap in healthcare, and there are a lot of people, a lot of needs for Korean doctors. And the stays, how many days you stay in Korea, is also related to the medical service. And I want to offer the shortened period for stay, because the shorter you stay, the more likely you feel comfortable and convenient. And aftercare, follow-up care is also important, because people want to know if I am being taken care of well. And next is soon. S stands for soon. So a lot of people these days, especially mothers, they don't have much time. They have to take care of their family. They have to work for working mothers. But there are certain things that mothers also want to do, but they don't get phone calls soon enough, quickly enough. So quick connection and quick interaction is a very important factor to mothers, busy mothers. So what is the difference between women's hospital and OBGYN hospital? The special hospital system by Korea is mostly called the women's hospital, but there's a difference between the women's hospital and OBGYN hospital. If we just focus on the fertility care, OBGYN hospital is more focused on fertility and delivery, but women's hospital is more comprehensive, offers wider services compared to OBGYN, and that includes the plastic surgery and the other diseases related to the breasts and urogynecology and the skins, derma, beauty, cosmetics, and eye care. Everything is included under the category of women's hospital, but OBGYN hospital focuses more on OBGYN care. And next is Women's Cure and Care Tour. I made this slogan, and I call this cure tour is because you come to Korea to be cured or to get treatment. For example, if you have some diseases or disorders in your women part, And if you come to Korea to get treatment, there's going to be a consultation session to see where you're sick. And you have to prepare for the entry coming to Korea. And then you get treatment or operation. And then maybe you can take out some time for sightseeing. And then you go back to your country. And there's a follow-up care. And maybe to the next cycle, move to the next cycle. So this is a cure tour cycle. And the important direction for this cure tour is that the focus should be on the treatment process and care process, and how well the patients feel is most important, because you have to be healthy and feel good to do some sightseeing, and that has to be cared or taken care of by the healthcare workers. Doctors have to decide that you're good enough to do that, and there should be a backup or personnel who can always care about the emergency incidents. And next is care tour and medical sightseeing. So you're not sick, but you go to certain countries, but while you're there, you just want to take a look at some hospital and take some care and treatment. For example, cosmetics or plastic surgery or derma. So if you're not sick anywhere, you can come back to your country, and maybe you can come back next time. So it's not for treatment, but it's just for leisure or wellness. And it can cater to the schedule of the clients more. And important factor here is concierge service and satisfaction level of the clients. And of course, the flow must survive here, must be present here too. So this clients must feel good after getting the service. And another big pillar of this presentation is wellness. In 2022, which is post-pandemic era, what could be the strength of Korean medical industry in attracting the foreign patients here? So I like to define wellness program like this. And this is the what clinical departments attracted the most patients starting from 2016 to 2019. So there's a intestinal, internal medicine, and plastic and derma, and checkup center, obgyn. But if you look at the population of nationality-wise, you can see that how the US and Russian patients increased, and Japanese too, compared to 2017 to 2018. So there's a change in demands. This is the patients as per the country. So you can see how Chinese patients and US patients are the biggest group of foreign patients. And this is the vaccination rate as per the country. And you can see Russia, Kazakhstan, Uzbekistan, Mongolia, China, Japan, and Vietnam. And Mongolia accounts for 51%. And the policy of self-isolation is that for Russia and Kazakhstan, there's no such policy. You can just submit the negative PCR test result. And this is the same to Mongolia. No self-isolation. You just submit the PCR result. But for China, Japan, and Vietnam, you have to take the 2-week self-isolation period. And starting from July 1st, I got this from an article. If you got vaccinated overseas, then you don't have to self-isolate after coming to Korea. And this applies to any foreigners coming to Korea. And if you come to Korea to see your family, direct family, and then you can enter the country once you submit the certification that you got vaccinated. But nothing's set for the foreign patients that come to Korea for medical tourism purpose. And no one knows what's going to be the policy, but we have to be ready for any policy. And this is the current situation as per the visa issuance. And due to the COVID-19, the visa exemption agreement was on hold. So except for the traditional Korean living in CIS countries, the visa issuance was denied to anyone entering Korea. And foreign patients who had to come into Korea to get some radiation treatment, and they got denied the issuance of the visa, and they died before coming to Korea. It's a shameful story because they don't have the access to the treatment and medication they need in their country, and that was why they wanted to come to Korea. And for example, for the fertility clinic, the frozen eggs were left in Korea, and the expiration years is 5 years. So we can keep the frozen embryos for 5 years, and then we have to throw them away. And the frozen eggs frozen embryos are mostly from 2016, 2017, and 5 years have already passed, and we have to throw them away. And the mothers, the parents cannot come to Korea. That's the problem. And there's also a case where they want to have a twin, and they want to have their twin babies in Korea, but they couldn't get the visa to come to Korea, so they are not able to do that. So public-private cooperation is really important because the operators and public organizations and hospitals have to closely work together. And of course, public organizations and public agencies have to be active in providing funding and identify the hospitals that can provide services, and also establish the remote healthcare system. And for hospitals, currently they shrank the operation of the international cooperation team under the COVID situation, but they have to reactivate it, sort of. And they also have to develop the medical tourism program, good program, attractive enough to induce the foreign patients to come to Korea to get the service. And also have to resume the training system for the healthcare workers and experts. And for operators in business, you have to know the situation of foreign countries and share the insights with private organizations. And they also have to promote the program made by the hospitals and other organizations. And they also have to secure good human resources for translation and concierge service, for smooth provision of medical service for foreign patients. So what have we done so far? With the cooperation, through cooperation with Incheon and Korean Tourism Organization, we held 6 rounds of online B2B sessions, and we did this medical sharing and participated in an online platform to prepare for post-COVID situation. And we're running consulting center online for Mongolia and China patients. And there are a lot of foreign patients who cannot go out of Korea because of the COVID-19. And they're also the promotion targets. So we are doing promotion offline and online for the foreign patients or foreign students who are staying here. I'm going to show you some photos. This is for the medical service sharing, and the promotion video shooting, online session. And you can see how parents are holding their baby, newborn baby here. And what area is the most frequently consulted? Well, during the expansion period in 2020, it was about some emergency treatment cases. For example, fertility clinic, the IVF, the frozen embryo management service, and for high-risk maternity delivery and the maternity cancer, like uterus. And in 2020, people are getting vaccinated and there's a treatment coming out. We're recovering from COVID-19, hopefully, and the consultation inquiry is mostly about wellness added to the previous inquiries. For example, the plastic surgery and for example, the operation, the vaginoplasty, and the self-isolation exemption or immunity medical checkup. And some people need some invitation for the issuance of visa in their countries. And this is the wellness program offered by our hospital. There are 3 categories: mother and daughter. For example, young daughter and young mother, and a little middle-aged mother and an old middle-aged daughter and old mother. And there's also a relationship between friends. So when a baby girl is born and she grows up to be a young girl, and then goes through the period and menstruation and gets married and becomes mother. And mother wants to be a girl again. That is the cycle that I see in a woman. So recovery is a key word. And recovery is a key word for our hospital. So for the first category, for mother and daughter, is a menstrual irregularity, and HPV vaccination and medical checkup. And that also covers the infertility clinic and slimming and immunity boost. And for friends relationship, the vaginoplasty and the derma and beauty care and the HIFU and other operations for your uterus, and slimming, that is for diet and for boosting your immunity. And for couples, married couples, you can either plan the pregnancy, or if you're having trouble having baby, fertility clinic, and after delivery care. And of course, you have to make sure the baby is healthy, and after delivery care, and then you have to go back to your body before having a baby. So that is slimming your body, and that is for diet. So a mother has to go back to be a girl again. So what are some priorities for medical tourism recovery? Well, there are 3 things. Budget. We need budget to restore the infrastructure. And second, self-isolation exemption for the people who got vaccinated. And of course, this requires a lot of consulting and inter-organizational discussion. And the third one is visa issuance. Without visa, you cannot even come to Korea. You cannot even enter the country. So visa issuance is the most important thing here. That is the first step and key point in recovering the medical tourism. Thank you very much for listening to my presentation.
Thank you very much for the presentation, Ms. Lee. And it was time to take a look at the OBGY care, its present and future. Next speaker is Representative Director Lee Jong-ho from 밝은 세상 Eye Hospital, who will talk about eye clinic care as a medical tourism product after COVID. And we'll see a video clip of the presentation.
Good morning or good afternoon. My name is Lee Jong-ho, Representative Director of 서울 밝은 세상 Eye Clinic. It is a great pleasure to be part of the 2021 Korea Tourism Organization's Medical Wellness Tourism Fair as an ophthalmologist. Let me begin my presentation. Today, I will talk about the current medical tourism environment, experiences, and major treatment services in the field of ophthalmology. Additionally, I will also touch upon what we have to prepare for the post-COVID era. First, let me talk about the current medical tourism environment. As a result of analysis of many cases of vision correction surgery on foreigners, we found out that the reason why they choose Korea is high quality of medical services along with reasonable expenses. Korea introduced vision correction surgery about 30 years ago. Since then, the technical skills here have been continuously developing to the point where we are now leading the global landscape. International patients are satisfied with our performance thanks to our abundant experiences in surgeries combined with a mature medical environment. In addition, appointment and consultation are carried out in a swift manner. Moreover, patients can go through examinations and surgeries in the same day, meeting the criteria of efficient schedule management, which is most important in medical tourism. The medical services and tourism can be achieved at the same time. We have gone through the preparation stage for medical tourism from 2009 and 2013. And from 2013 to 2016, we achieved such a remarkable growth. And up to 2020, before the outbreak of COVID-19, we continued to grow dramatically, contributing to the development of the Korean medical tourism sector. My hospital, 서울 부산 밝은 세상 Eye Clinic, has been actively participating in medical tourism projects. To reassure international patients from different cultures visiting my clinic, we have made multi-directional efforts. First, we acquired a globally renowned medical certification presenting an international standard of safety to foreign patients. The certifications include the JCI accreditation, certification of excellent institutions by the Ministry of Justice, and KHMA certification recognized by community health centers in Korea. Second, we have taken part in medical tourism-related activities managed by government agencies such as Korea Tourism Organization, Ministry of Health and Welfare, Seoul City and Gangnam-gu District Office promoting my clinic. Third, based on the continuous exchange with global, regional, and domestic partners, we have been raising brand awareness of my clinic and exposing ourselves to international patients. These efforts paid off, so we could become an eye clinic garnering interest in the field of medical tourism. Let me talk more about JCI accreditation. JCI accreditation has a public confidence since it is recognized by the World Health Organization. It is a globally renowned accreditation and evaluation system which monitors the entire process of medical service from admission to discharge of patients. 서울 부산 밝은 세상 Eye Clinic was accredited by JCI 3 times in 2011, 2014, and 2017, and it is the first case in Korea. My clinic always maintains the most advanced medical equipment including surgical lasers, manages safety in a strict manner, and establishes the patient-centered system. All this work helped us become certified as a leading eye clinic through the accreditation. Also, Seoul 밝은 세상 Eye Clinic was appointed as an excellent medical tourism hospital by the Ministry of Justice. The Ministry of Justice operates the system of excellent medical tourism hospital to vitalize medical tourism in Korea and prevent excessive brokerage activities. The appointment is renewed every 2 years after a thorough re-evaluation, and my clinic has been appointed 4 times in a row since it was first appointed in 2014. That means our services have been recognized both quantitatively and qualitatively. Since we are an excellent medical tourism hospital, international patients can just visit us and present their visa issuance certification number for electronic visas without any additional paperwork. Even family members or caregivers of patients can enjoy the same benefits, so they have an advantage of using our clinic services in a more convenient way. Now, let me talk about major items of medical tourism in ophthalmology. We deal with all age groups ranging from children, youth to older generations. It is hard to perform laser surgery on people under 18. So, to improve their vision, we provide dream lens vision therapy. For people between 20 and 40, we have a vision correction surgery to improve myopia and astigmatism. LASIK and LASIK are the most widely known. On top of this, recently, SMILE LASIK has become popular. And for ultra-high myopia, we offer intraocular lens implantation. For people over 40, to improve presbyopia and cataract at the same time, we provide multifocal cataract surgery. In case of LASIK and LASIK, we work on the surface of a cornea with laser to correct vision. But with SMILE LASIK, we only correct stroma underness while maintaining the surface of cornea. In case of SMILE LASIK, laser penetrates under the cornea without damaging the surface and makes a precise incision on the stroma, and the incision size is only 2 mm, which is minimal, and the separated stroma is removed to correct the vision. Compared to the existing surgery method, the damage on cornea decreased by more than 90%, so the recovery of vision is much faster and safety is highly guaranteed. Since you can go back to your daily lives swiftly, there is a high demand for this surgery. But since it requires a high precision of techniques, I recommend hospitals with abundant experiences and proper equipment. My clinic has been performing SMILE LASIK surgery since 2010, accumulating rich clinical experiences and securing relevant technical skills. Next, we have intraocular lens implantation. As I explained before, SMILE LASIK is a vision correction surgery working on cornea. The intraocular lens implantation is a method to implant a special lens in the eyes. If a patient has a too thin corneal bed or has ultra-high myopia or astigmatism, we perform intraocular lens implantation. 서울 부산 밝은 세상 Eye Clinic is equipped with various types of lenses, which could be applied to different patients depending on their eye conditions. That is why we have a wide range of patient groups. Unlike other vision correction surgeries, due to safety issues, intraocular lens implantation could be performed on only one eye a day. But recently, that is not the case. There is a hole in the central part of the lens, which led to the removal of the prerequisite of iridectomy. And my clinic has a proprietary technique which enables us to perform surgery on both eyes in the same day. It is an advantage for international patients since they can shorten the stay. And we developed a method to implant the lens vertically for the first time in Korea, which drastically reduced the potential side effects and enhanced the safety at the same time. Cataract is a condition where normally transparent crystalline lenses become turbid and rigid, which lead to decrease in vision. Normal crystalline lenses pass the light to ensure the clear image on retina. But in case of cataract, lights can't fully pass the lenses, so the images on the retina become foggy or yellowish that result in symptoms where people can't distinguish colors clearly or see overlapping objects. It is the most common eye condition with aging, and the turbid crystalline lenses should be removed and replaced by transparent artificial lenses for treatment. And by implanting multifocal artificial lenses which ensure clear short-range, long-range, and even medium-range images, we can not only treat cataract but also deal with complex ametropia. In particular, we have the technique of laser multifocal cataract surgery, where the entire process is done by laser. It reduces errors and further improves safety. Also, we are equipped with the most advanced laser for cataract surgery, so we can perform customized surgery depending on individuals' eye conditions. With increased use of personal computers and smartphones, as well as changes in the air environment, eye fatigue has increased, which resulted in an increased cases of dry eye syndrome. If you have dry eyes, you encounter uncomfortable symptoms such as stiffness, irritation, and bloodshot eyes. In severe cases, cornea is damaged, which could lead to decreased vision and eye inflammation. Dry eye syndrome occurs because tears dry up too fast, and the cause of this syndrome differs by individuals. That is why we are providing therapy which targets the fundamental cause. First, we run a comprehensive test to find out the cause. Afterward, we provide eye care medicine, aqua care with fomentation, moisturization, and cleansing. The next step is laser treatment on meibomian gland around the eyes where sebum secretion becomes activated to help the normal lacrimation. In particular, aqua laser was recognized as a new medical technology by the Ministry of Health and Welfare, so it has proven its safety. Since last year, international exchange has been dramatically decreased due to COVID-19. The same goes for the medical tourism market. To prepare for the ophthalmology medical tourism after COVID, we need to prevent infectious diseases such as COVID-19 by complying with preventive measures and blocking all the potential causes of infection at hospitals so that we could provide medical tourism services in a safe manner. At my clinic, all staff check their body temperature and wear masks, and all visitors fill out the consultation questionnaire. We have to closely monitor whether someone has fever through thermal imaging cameras, and all visitors are required to check their body temperature, wear masks, and sanitize their hands. And we also check the health status of the visitors as well as their record to find out whether they have visited other countries before. And my clinic uses a plasma air sterilizer to maintain a clean space, and by carrying out disinfection and preventive measure at clinic, we are blocking all the potential cause of infection. Also, unlike before COVID, foreign visitors have to go through a much complex procedure and paperwork. Thus, for a customized service, we should redevelop the guidelines for medical tourists on required document for immigration, stay, and visit to hospitals based on the current criteria. And to help medical tourists make a decision, We have to tap into tools like SNS in order to reinforce indirect experiences and to give easier access to information on hospitals. This is about further enhancing marketing activities. For international patients, it is hard for them to visit clinics in Korea very often. That is why to ensure a better communication between hospitals and patients, we have to closely work with local partners. Remote medicine can be one method, so we need to build a related system. And international delivery of pharmaceuticals can be also explored as an alternative. Last point I want to emphasize is that we need to strengthen our capacity to treat international patients. To attract and manage international patients, we need to make our services more concrete by supplementing the related system. A case in point is interpretation service for a better treatment. We can also develop better consultation and professional examination system and reinforce capacity for risk management and administrative work. If we can prepare in this direction, I believe that the medical tourism in ophthalmology could be further vitalized in the future. International patients are easy to be tense due to unfamiliar environment and surgeries. That is why we need to provide a safe and comfortable recovery environment for them after surgeries. My clinic has a premium space for recovery, which is called the lounge. It is a wide space for recovery, which is not common at eye clinics. Here, we provide one-on-one personal care and private recovery room to ensure a comfortable and safe recovery. We strictly manage potential infections, provide a pleasant space, and even ensure a full prevention of patients. That is a non-stop service from surgery to recovery we offer. My clinic is visited by patients across the globe, including China, Japan, the US, Russia, the Middle East. And our visitors have diverse occupational groups, so there are celebrities, students, and office workers. And we perform various types of surgeries ranging from SMILE LASIK, intraocular lens implantation, LASIK to cataract surgeries with excellent results. Let me wrap up my presentation with a video clip of international patients who visited my clinic. 이거의 수술 후에 한 달 뒤에 찍는 영상입니다. 놀라운 한 달이었는데요. 처음 보시는 분들을 위해서 설명하자면 저희 둘 다 한국에 있는 밝은 세상 안과에서 근시와 난시를 교정하기 위한 ICL 수술을 받았고요. 저희는 예상했던 것보다도 훨씬 더 놀라운 경험을 하고 있습니다. 전체 과정이 굉장히 원활했고 효율적이었어요. 처음부터 정말 잘 왔다 싶더라고요. 제가 수술을 받은 게 1월 21일이니까 저는 수술 받은 지 2달 됐고요. 쉬니드 같은 경우에는 저는 한 달 됐습니다. 수술 날짜가 2월 20일이었고 그래서 이제 각자 한 달, 2달 됐네요. 이 영상에서는 저희 지금 저희 시력이 어떤지 또 수술에 대해서 혹시 후회하는지 회복 과정은 어땠는지 말씀드리려고 해요. 제 얘기부터 할게요. 제가 블로그에도 쓴 내용인데 수술 자체가 아프지는 않았어요. 회복 과정에서도 사실 전반적으로 좋았어요. 충혈이나 불편한 점은 없었고요. 그런데 그 전에 보여드리지 않은 게 하나 있습니다. 회복하는 첫 2주 동안은 잘 때 이 안경을 썼어요. 그 다음날부터는 사실 쉬어줘야 하는 시간이 따로 없었고요. 수술 후에 한 달 뒤에 검진에서 의사 선생님이 제 시력이 13이라고 말씀하셨는데 20보다 좋은 거래요. 저는 그게 가능한 건지도 몰랐어요. 20이 최고 시력이라고 알고 있었거든요. 저도 20이면 완벽한 시력이라고 알고 있어서 그것보다 제 눈이 더 좋다는 사실에 굉장히 놀랐습니다. 또 드리고 싶은 말씀이 아침에 일어나자마자 세상이 잘 보인다는 게 굉장히 기분 좋은 일이에요. 축복이라고 할 수가 있죠. 제 생활 전반과 일상이 훨씬 편해졌습니다. 렌즈나 안경이랑도 실험할 필요가 없어졌고요. 안경을 쓰긴 하는데요. 이게 블루라이트 차단 용도입니다. 직장에서 컴퓨터 앞에 하루 종일 앉아 있을 때 쓰는 거고요. 블루라이트 차단 안경은 밤운전 하실 때도 추천합니다. 제 영상 보셨는지 모르겠는데 저는 수직 ICL 수술을 받아서 제 렌즈는 수직 삽입, 친구 렌즈는 수평 삽입된 상태예요. 수평 삽입이 기존 방식이고 제가 받은 수술이 이제 새로운 방식입니다. 한 달경과 검진을 받았는데 제 눈이 잘 회복되고 있고 지금까지 다 좋다고 하더라고요. 이제 시드니보다는 제가 추가 검사를 더 받았는데 왜냐면 수직 삽입이 새로운 방식이라서 제 렌즈가 자리를 잘 잡았는지 움직이거나 위치가 바뀌진 않았는지 살펴봐야 한다고 하셨어요. 그리고 제 시력이 20, 15라고 했는데 이것도 20, 20보다 좋은 거죠. 영상에서 보셨는지 모르겠는데 글자가 써있는 보드를 보면서 시력 검사를 해요. 대부분은 잘 보여서 맞췄는데 딱 하나 틀렸어요. 저는 F인 줄 알았는데 P였거든요. 이제 두 개가 비슷하게 생겼잖아요. 근데 그렇게 작은 글자가 보인다는 것 자체가 정말 신기했어요. 제 콘택트 렌즈 낄 때도 그 정도로는 안 보였으니까요. 맞아요. 그래서 영상 보시면 제가 시력 검사하시는 장면도 보실 수 있는데요. 잘 보인다는 경험 자체가 정말 좋고 렌즈나 안경 신경 쓸 필요 없이 일어나자마자 명료하게 보이는 게 정말 좋아요. Thank you very much.
Thank you very much, Mr. Lee. And listening to the presentation, I was able to envision foreign patients visit Korea for eye medical care after COVID. And we have one more presentation to go, which is about Korean medicine. And this doesn't end here. However, the panel discussion awaits us. So the last area, traditional Korean medicine, and we'll invite the speaker, Professor Lee Eui-ju from Kyunghee University School of Korean Medicine, who will talk about present and future of Korean medicine, its importance as a medical tourism product. And let us meet the speaker through a video clip.
Good morning or good afternoon. I am Professor Lee Eui-ju of Kyunghee University College of Korean Medicine. Today, I will talk about the present and future of Korean medicine. As a subtopic, I prepared a talk on the importance of Korean medicine as a medical tourism product, as well as the trends of Korean medicine therapy. This is the table of content. As you see, I have two parts on the present of Korean medicine. One of them is about the overview, system, and current status in general. And the other is about medical tourism, with a focus on the export of the Korean medicine industry and attraction of international patients. The third and fourth parts are about the future of the Korean medicine. And I gave thoughts to what I will talk about here. And there was a report on future vision and blueprint for Korean medicine, so let me introduce that. For the last part, I will introduce the fourth comprehensive plan to develop Korean traditional medicine released by the Ministry of Health and Welfare, centering on medical tourism. The Ministry of Health and Welfare is regulating the industry with various policies. Under the system, we have Korean medicine doctors, and separately we have pharmacists in charge of urban medicine, and the general system was introduced in 1994. And there have been general practitioners and specialists, just like the Western medicine, since 1999. And we have community health center projects, such as Hub Community Health Center, which was introduced in 2005. It was incorporated into a comprehensive health promotion project in 2013. When you hear the word Korean medicine, you would think of traditional urban medicine. In standardizing the urban medicine, safety is very important. The standardization started in 1996 and it became mandatory in 2007. For distribution, in 2005, the real name system was introduced, and in 2012, it became mandatory to distribute the standardized products to ensure the safety of medicine. There have been organizations for the Korean medicine industry. With the launch of the Korea Institute of Oriental Medicine in 1994, followed by the launch of Korean Medicine Industry Team in 2005, and the recent launch of Korea Oriental Medicine Promotion Agency in 2016. Let me talk about legislation. With the establishment of the Act on the Promotion of Korean Medicine and Pharmaceuticals, the first comprehensive plan to develop Korean traditional medicine was developed. The new iteration comes out every 5 years. In 2018, the Act on the Promotion of Korean Medicine and Pharmaceuticals was revised, and up until now, the second, third, and fourth comprehensive plans have been released. And policies have been run based on the plans. For education, we have 11 colleges of Korean medicine, and in 2008, Korea established a National Graduate School of Korean Medicine, so we have 12 educational institutions in total. The Ministry of Food and Drug Safety is also running policies on Korean medicine and pharmaceuticals. About pharmaceuticals, the GMP system was initiated in a full scale starting 2015. And in 2013, the regulation on safety and quality of medicinal herb was established. Let me move on to the resources. The number of Korean medicine doctors is about 25,000, and the number of Korean medicine pharmacists is about 1/10 of it. And the number of pharmacists who are licensed for Korean medicine preparation is also about 25,000. When we look at the number of medical institutions, there are about 350 hospitals of Korean medicine and about 15,000 clinics of Korean medicine. The survey on utilization of Korean medicine and consumption of pharmaceuticals is conducted every 3 years, targeting the general public and other types of users, and the survey result is reported. For the industry as well, the survey is carried out every 2 years with a focus on manufacturing, retail, and healthcare services to find out the current status, which is also reported. Now, let us look at international patients by different sectors of Korean medicine. About 10,000 international patients received treatment in general Korean medicine in 2019, with about 30% growth every year. By sectors, acupuncture therapy, which deals with musculoskeletal conditions, has the largest share, followed by internal medicine. And the therapy related to obesity takes up about 7%, whereas skin, clinic, and beauty account for about 3%. When it comes to nationality of patients, about 40% of them are from Japan. The second and third largest portions came from China and the US. We are witnessing more and more patients from Russia, Mongolia, and Kazakhstan. Let me talk about research activities. Based on research, we collect evidence, and sometimes we find a new body of evidence. It requires a continuous investment in R&D at the national level. Out of the total healthcare and medical budget, about 6% goes to the Korean medicine, which is approximately 110 billion Korean won. Most of the research activities are regulated by the Ministry of Health and Welfare. Development of new medicinal ingredients and medical device continuously has new projects with a stable investment. And traditional medicine has been used for a long time. So there are research activities to collect evidence from the perspective of modern science. Other than that, the Ministry of Science and ICT runs more than 200 projects every year. The Ministry of Food and Drug Safety spends about 5% of their budget on around 30 projects to find out the efficacy and safety of herbal medicine. This is the current status of import and export. Ginseng takes up the largest share for export. In terms of import, the biggest share goes to medicinal herbs. Looking at the service, the share of Korean medicine in national health insurance claims is around 7%, accounting for 3.5% of medical expenses, so it is between 3% and 4%. This slide shows the trend in overseas markets for traditional and integrative medicine. When we look at the global complementary and alternative medicine market, the US is the biggest one, followed by Asia Pacific, Europe, and others. In case of herbal supplements, Europe has the biggest market, followed by Asia Pacific, Japan, and the US. Then, who are the outpatients and inpatients at the Korean medicine institutions? As of 2019, top 10 reasons to visit institutions of Korean medicine were mostly musculoskeletal conditions for outpatients. In case of inpatients, top 6 reasons were musculoskeletal disease, followed by brain-related or neurological disorders. Now, let me turn to medical tourism. In response to the changes in the worldwide traditional medicine market, we need to protect the Korean medicine industry. Why is that? Nagoya Protocol came into effect in 2014, and since then, countries around the world have been striving to protect their own national interests. And WIPO has been leading a discussion to protect knowledge of traditional medicine in different countries. And in the field of traditional medicine, through the ISO, countries across the globe are trying to hold a competitive edge in the process of standardization, which means they implement strategies to become the standard of the global market. And at the WHO, the competition to lead international discussion on traditional medicine is extremely fierce. When we look at the size of the global traditional medicine market, by 2030, it is expected to be worth about $380 billion with an average growth rate of 15% per year. China exported traditional medicine products worth about 4 trillion Korean won to other countries in 2017. In Japan, a company named Tsumura is leading the globalization of herbal medicine by specializing itself in herbal medicinal ingredients. Then, what is the situation in Korea? The manufacturing companies are mostly small scale. That is why export is not active, and the export amount itself is also small. The reasons include the lack of professionals, business scales, brand recognition, as well as legal and administrative difficulties. But still, the biggest obstacle to export is the lack of specialists in the field. Although the number of international patients in Korean medicine is continuously growing, it doesn't have a large share in the total number of medical tourists. For example, in 2018, there were about 460,000 international patients, out of which 22,000 received Korean medicine therapy. So it was 4.8%, which is close to 5%. Of course, compared to the past, we are witnessing the growth of the number of patients by 30% every year. Still, the absolute number is small, so we need to respond to that. And patients from Japan, China, the US, and Russia account for about 70%. To attract international patients, we have to promote our services and fully support the professionals. At the same time, we need to raise our brand awareness and develop new products in a constant manner. These are very important measures. And this is the result of economic feasibility analysis on attraction of international patients. In 2017, the industry income was 11.3 billion Korean won, and the average per capita medical expense was 560,000 won. Looking at the production inducement effect, it was 450 billion won in 2017, but it will grow to more than 1 trillion won by 2030. And for the job creation, when we host 1,000 international patients, 96 new jobs are created. As such, attraction of international patients has a huge effect on both production inducement and job creation.
지금 전 세계가 코로나 19로 인해서 많이 어려움을
The whole world is under the impact of the COVID-19. The world is suffering from the COVID-19, and people are not moving cross-border, and I believe it's taking its toll on the medical tourism sector. And I believe there are some concerns that this might continue for some time. So I think we need to make a shift toward online-based promotion. So when the COVID-19 ends in the near future, hopefully, we need to have some proper strategy to attract inbound patients. And I took a look at the current status of Korean medicine so far, and I am going to talk a little bit about future direction of Korean medicine. And I refer to a report, Korean Medicine 2050 Future Vision, published by Korean Medicine Research Institute. So what exactly is shaping the future of healthcare and Korean medicine? What could be a core variable? So this report focused on the two factors of scientification and globalization. So scientification is about measurement and quantification, and globalization is about expanding or promoting the value of Korean medicine and improve the utilization or usefulness of Korean medicine. So using these two standards and doing some smart analysis, the report is building up 4 scenarios about the future. So there is a case where we both achieve globalization and scientification, and part of scientification, and less globalization. Maybe focusing on the domestic demand a little bit more. And maybe in the scenarios where good globalization but less scientification. And fourth one is where we fail at both standards. And this report takes quite a realistic approach. So in the next 2 to 30 years, maybe there will be less globalization but more scientification. And it is talking about the first scenario, best scenario, which is talking about magical shield of Korean. And Korean medicine has some characteristics for example, it focuses on your body characteristics, your body types. And the report also takes a look at the convergent technologies.
that combines with the characteristics of Korean medicine, and twin technology or other convergence technologies like biosensing technology and VR digital technologies. So now I'll move on to the vision of 2050. So this report talks about a certain future, hopeful future based on the first best scenario, which is number one, the magic shield for Koreans. Then what do we have to exactly prepare? There are 9 core tasks related to the health management. And there's also another project related to the Korean Medicine Cube, a platform, or AI technology, or big data, new materials, or nurturing the talents, or building ecosystems. So there are 9 boxes, 9 categories, which is a core tasks for the future of Korean medicine. And lastly, I would like to talk about medical tourism. As I mentioned this in the earlier part of my presentation, I referred to the 4th plan for the Korean medicine development by the Ministry of Health and Welfare. So according to the 4th plan, the basic vision would be improving health and welfare through Korean medicine, as well as to strengthen the industrial competitiveness. And there are 4 objectives. And we focus on the second objective, which is to improve the system of using Korean medicine, Korean medical service. And the 4th one, to strengthening the global competitiveness. And I believe the 2 topics are closely related to Korean medicine development. So regarding the improvement of the system as a whole, the report is talking about collaboration between the Korean medicine and the Western medicine. So globally, Korea is probably the only country with a unique selling point. We have to pay attention to this. So by collaborating between the Western medicine and Korean medicine, healthcare system could be improved even more. So starting from 2017, there have been many pilot projects. Actually, 3 stages of pilot projects that started in 2016 and entered into the second stage in 2017 and third one in 2019. And by establishing a model through establishing a model after those pilot projects, do some analysis, and establish the final plan. So instead of choosing between the Western medicine and Korean medicine, we can present an opportunity of treatment that bridges or that combines the 2 medical areas. And this is the quite unique selling point of Korean medicine. Regarding strengthening global network of Korean medicine, we will establish a governance that oversees the globalization. So currently, there are many fragmented and segmented operation because there are so many organizations under the Ministry of Health and Welfare. So we have to have one umbrella organization or platform that can strengthen the cooperation. So we have to have the foundation or platform, as I say.
파트너를 발굴하고 협력 채널을
And we have to
구축해야
build a
되겠습니다.
global hub
그래서
network
어떤 시장
in
동향이나 이런 그 현지
um,
정책
major
예방에 대해서 알수
countries
있도록 해야 될 것 같고요. 또 하나 좋은 게
so that we
뭐냐면
can know about market trends and the policies in those countries. And one important area is joint research. We have such a great research capacity in Korea, and I believe that could be a really big strength in trying to build a research network with many countries in the world, and that could work as a foundation for medical tourism. And raising awareness about Korean medicine is also important because we still have a long way to go regarding the awareness level of Korean medicine. So maybe we can make a personalized or customized contents for promotion that fits the sentiments of each country. And we also have to have more conferences for joint research efforts and to identify more agenda. And we also need to have more ODA, Korean medicine ODA, and we are still a divided country between the North and the South. So North-South cooperation is also a very important area, and we need a policy support in that. And Korean medicine also should make inroads into a global market, but going through the COVID-19, the online promotion efforts might be more appropriate. So the promotion is about policy or training, education, and the clinics should also be promoted more through, for example, videos. And there should be also promotion about medical devices, Korean medical devices. And online training can also be provided, training about Korean medicine. And the real-time response is also important. So there should be enough information about permission and certification in foreign countries, and maybe consulting services could be really helpful. So we can take advantage of opportunities for business meetings or expos and conferences. And we have to strengthen our capability of attracting foreign patients. So we need to have strategies, and there should be some support for the specialized program. The most popular one is the obesity or dermatology, and sometimes it's internal medicine and musculoskeletal, of course. This is the most popular one. So these are the area where most patients come to Korea for. So we need to have appropriate training program and translation service for the foreign patients. So far, I touched upon the past and the future aspects of Korean medicine related to the medical tourism. And I really hope my presentation was helpful to you for those of you who are interested. Thank you.
Yes, thank you very much, Professor Lee Eui-ju, and it was an opportunity to get to know about Korean medicine. And we will move on to the next corner, which is a panel discussion, inviting our speakers. And present here on site are Professor Chung So-hee from Seoul National University Hospital Healthcare System, Gangnam Center, and Ms. Lee Soo-jin, Vice Director of International Cooperation Team at Seoul Women's Hospital. While joining us through online are Professor Lee Eui-ju from Kyunghee University Korean Medicine Hospital Stroke Center, who is also an academic vice president of Society of Korean Medicine, and Professor Ko Sang-baek from Yonsei University, and Mr. Lee Jong-ho, representative director of Seoul 밝은 세상 Eye Hospital.
The whole medical industry has never been busier than now, burdened with heavy workload from COVID. Thank you so much again for your precious time today. We appreciate it. The focus of today's panel discussion is focal success points for 5 new medical tourism promotion areas after COVID from the perspective of medical industry. I believe those of you watching the show could be in the medical industry or could work at a field related to attracting foreign patients. So I would like the panelists to freely share your opinions about some advice you think is important for those working in the field to attract foreign patients or important things for them to remember, etc. So even though we're calling this panel discussion, I would much prefer that you think of this as free talk show. Furthermore, it's a rare opportunity where healthcare experts and frontline employees of 5 different medical areas are gathered together, and good opportunity for the panels too. And over to you, Ms. Kim Hana. Hello. Welcome to the panel discussion of the Medical and Wellness Conference. The medical tourism will be fast growing after the COVID-19 crisis, and I watched all the presentations and I really enjoyed them. And now we've entered the panel discussion, and we have several speakers, but several more joining through Zoom and online environment. And on site, present here is Professor Jung So-hee from SNU Hospital Healthcare System, Gangnam Center, and Ms. Lee Soo-jin, Vice Director of International Cooperation Team at Seoul Women's Hospital. And we have several more speakers joining us through Zoom online, and we have Professor Lee Eui-ju from Kyung University Korean Medicine Hospital Stroke Center, who is also an academic vice president of Society of Korean Medicine. And we have Professor Ko Sang-baek from Yonsei University Wonju School of Medicine, Preventive Medicine, and Representative Director Lee Jong-ho of Seoul 밝은 세상 Eye Hospital. And we have 5 panelists, and thank you very much again for joining us for the panel discussion. And the topic of the panel discussion is focal success points for 5 new medical tourism promotion areas after COVID from the perspective of medical industry. And we've been talking a lot about health and the healthcare, and I believe that's due to the COVID crisis that made us realize how important health is and the medical technologies that support the healthcare. And of course, now we are still seeing some difficulties of cross-border movements, but vaccination is being completed globally, and travel bubble movement and other hopeful system initiation. And I think it's all positive sign that tells us the resumption of global tourism, including medical tourism. So assuming that there will be reopening of borders among countries, I have several questions. First, about the general prospect for the medical tourism. So where do you see the biggest demand, or what is some concerns about the future prospect? First, Professor Chung.
Korea has the world's best medical technology. There is no doubt about that. And the staff and infrastructure, system, medical equipment, they are all high quality in Korea. And when we look at the clinical departments at hospitals, they are working on JCI certification, so there are quality hospitals in the country. So when we look at this situation, not only plastic surgery and dermatology, I believe that medical checkup will see a growing demand. And there is a much smaller number of foreign patients now due to COVID, but there will be a growing number of foreign patients in the future. That's why we are bracing for the future. So you said that you are bracing for the future, and we are looking forward to the future development.
What about you, Ms. Lee Sujin? What would be the future forecast? Yes, Korean medical tourism market will see an exponential demand growth in the future, and vaccination will increase. And if they feel that Korea is safe enough, we will see more and more tourists coming into Korea. But of course, we have to look at and wait until the end of 2022. But as you said, other presenters said, the medical service is of high quality, but the price is quite reasonable here in Korea. So the focus will be on maintaining the health, because you are so thankful that you survived this crisis. And maybe you want to give some gifts to you as a reward. And I heard about the trend regarding the revenge shopping. You know, there's a long line in front of Chanel store and boutique. So maybe you want to make yourself stand out again, you know, taking off masks and doing some shopping to make you more beautiful. But one concern is that it's not just a trend in Korea, but many other companies like South Asian countries and Turkey and Israel, all of them are competing for the medical tourism and attracting the foreign patients coming into their countries. So we have to be well prepared. Yes, thank you for the comment. You're saying that we have to think about the competition that's going to get fierce in the post-COVID era. So the strength we would have, high technology and a reasonable price, but we should have more, right? Professor Lee, what do you think? What do you think about the future prospect?
Last year and this year, the medical tourism industry was in a dire situation. It is true, but I work in Korean medicine, and before COVID-19, the growth rate was about 30%. Still, Korean medicine only takes up 5% of foreign tourists in Korea. And Russia and China and a few more countries are the most patients who are visiting Korea for Korean medicine services. What is so unique about the medical system in Korea is that we have two pillars of medicine, which is the Western medicine and Oriental medicine. And we have this collaborated program. I think this could be an iconic product for medical tourism in Korea. And recently, the government is supporting diverse R&D activities, and efficacy and safety will be proven for Korean medicine as well in diverse aspects. So in the future, when there is a foreign patient, they can utilize such programs for treatment. And you also asked what concerns I have. So I have 2 points of concerns. Attracting foreign patients is important because the recognition is not worldwide, I guess. And I have another concern to improve the quality of medicine. So for Korean medicine, when we look at the consulting staff and the staff who are working in interpretation, I think the personnel now is not sufficient. So we have to provide the training on such professionals. And in that case, we can see the explosive growth of such programs in the future. Thank you for the answer. So after COVID, there will be a growing demand for medical tourism, and Professor Lee agrees with other speakers on that, but the professor also shared his concerns.
We're taking a look at the prospect for medical tourism, and my first question goes to Professor Ko Sang-baek. So your opinion?
The opening of a new era of infectious disease can never be undone. So the most important thing is that we have to have an infrastructure that can protect us from infectious diseases, and I believe that is the way of attracting foreign tourists again. But despite all that, once the cross-border movement resumes, the medical tourism market will grow again. And I believe medical checkup and cancer treatment will be the most important area. That is, the cutting-edge medical checkup system and genomics-based precision medical personalized diagnosis and related treatment will emerge as an important area. And cancer treatment is a really important area under the precision medicine.
And this time, to Representative Director Mr. Lee Jong-ho, what do you think about the future prospect?
Amid the pandemic situation, Korea has been recognized as an excellent country to deal with COVID-19. Not only the preventive measures, but the entire medical system of Korea have garnered higher confidence among other countries. So when patients look for treatment and surgeries, they prioritize safety. In particular, COVID-19 made people more conscious about the environment at hospitals, so they have a higher criteria to choose the hospital. So even after COVID-19, safety will be the priority for patients when they make a decision. That is why, since we have a heightened status in the global market, I believe it will help us in the future for medical tourism. In the past, beauty was the major item, but in the future, we will see a growth in other serious diseases.
And then question to Mr. Lee. In attracting foreign patients, what could be the unique strength of Korea in attracting them to Korea?
Eye clinics in Korea have collected world-class clinical experiences. The US and Europe have advanced medical equipment and technologies, and Korea actively imported those equipment and services. And based on the excellent results of surgeries, Korea is now leading the global landscape ahead of the US and Europe. And what is the biggest advantage? It is the medical system. The medical system is comprised of excellent professionals, advanced medical equipment, and technical know-how. So this is a whole package. And international patients pay attention to Korean hospitals with the best medical system. From admission to discharge, the medical system manages the entire process. IT-driven medical service is another factor to raise the satisfaction among international patients.
As in attracting foreign patients, Korea has a very unique strength.
So we will go into specific clinical department. So when we attract foreign patients, what are Korea's advantages? So Professor Chung. So let me talk about medical checkup. So as I mentioned before, the quality of medical service is very high in Korea. And in case of a medical checkup, it is a one-step process. You can scan from top of your body to the bottom. But it takes not much time. Although you run many tests, it takes about only 3 hours. So you skip breakfast for the checkup. And my center is located in Gangnam, and they can have lunch after the 3-hour checkup, and they can enjoy the quality of service. And we have many other additional services for customer satisfaction, and we have a price competitiveness even. In Korea, when we look at the medical cost, if Korea is 100, the US is 300, and Japan is about 150. That means Korea has a price competitiveness. And when we look at Singapore's medical service quality is similar to Korea or higher, but they have this warm weather. And there are many countries who can come to Korea within 3 hours of a flight time. But the medical service is good, and we have great medical equipment. And in my center, specialists run all the tests, and we have interpreters. And we work with nurses from Russia, and we also hired interpreters from China. So the entire process is very comfortable, swift. And in my center, when we find any abnormality, we refer the case to SNU hospital. So compared to the cost they pay, the satisfaction level will be really high. And this is the clear advantage of the medical checkup in Korea.
In the area of medical checkup, we have a really good system and reasonable price. That is the competitive edge that we have. And how about OBGY? What strength do we have? In treating the OBGYN diseases, the strength that we have is mostly about fertility clinic. There are severe diseases, and the fertility and delivery and pregnancy, it's not a disease, it's just a part of your life cycle if you're a woman. And for severe disease, as Professor Jung said, we have such a high quality diagnostic technologies, and that is really the cause of many foreign patients coming to Korea, because there are a higher level of misdiagnosis or wrong diagnosis in foreign countries, especially in the process of looking at the image and making diagnosis. So this part is really important for severe diseases in particular. So Korea has a strength in that. And you also have a wider choice to choose from. And for example, for cancer, well, you have to take everything out. But for a benign cancers or benign tumors, you have to keep your organs. So you can just treat them. And we also provide treatments, well, some of which are banned in foreign countries. And Korean doctors are famous for high dexterity or high medical skills. And women having trouble having baby, they visit fertility clinic, which highly is dependent on the personal capability of doctors. And we also have strength in price. So combining all these factors,
I think Korea really stands out, and we also have a very high success rate of pregnancy. So that is the strength they consider. And China also is now gonna allow 3 children for a family. So I think there will be a lot of Chinese patients. And we also have a post-maternity care center. So that is one of the parts that mothers can enjoy, because mothers are usually not treated that well in their countries. And I think it's a part of K culture and the admiration that foreigners have towards K culture. And we also have a very good opportunity for shopping. So mothers, when they go back to their countries, they sometimes shop a lot, buy things a lot that they can't find in their countries. And I believe that's really a good point for attraction. Thank you for the answer. I could see what strength we have in Ojin care. And how about traditional medicine? Professor Lee? As I previously mentioned, there is an opportunity for collaboration in terms of system between the Western medicine and Korean medicine. And I think it's a really good marketing or selling point in attracting foreign patients, that you could get both treatments. And there's also a great medical checkup program using that collaboration, also in the process of recovery and the cancer treatment. And in China, or unlike China and other European countries, there's the safety of Korean medicine and or collaborated treatment is getting validated in terms of safety. And I think it's going to be a good competitive edge. But I can also see a lot of foreign patients suffering from the musculoskeletal diseases. So if we are able to offer services for these diseases, musculoskeletal diseases, or for diabetes management or obesity management, that would be really good. Yes, thank you for the answer. So it's important to focus on strength while complementing the weaknesses. That could be an effective strategy. So how about if we take a look at each clinical department? First of all, for medical checkup, Professor Zhang.
So you emphasized the high quality of a medical checkup system in Korea, but I know that Russia also has a high level of medical service. And CIS and Russian patients visit Korea for medical checkup. That's what I heard. Yes, true. There are many Russian patients. Also, many patients came from Kazakhstan before COVID. But when we look at the quality of medical service, Korea is much superior compared to those countries. And when we look at the medical cost, Korea offers much better prices, and we provide interpretation service, which is also high quality, and we have a great referral system as well. That is why many foreign patients prefer Korea, and many of them repeatedly come back to my center once a year or once in 2 years. Then, as I said, my center offers interpretation service, and the medical checkup centers in Korea can provide satisfactory services to foreign visitors. So I believe that if they come back for another checkup, that means they are fully satisfied. So you said that you provide a referral service to SNU hospital when you find abnormality. So if you detect unexpected disease, so the medical tourism should offer services for treatment as well. So when we look at the Korean medical tourism industry, do you have any difficulties in this referral process? So in general, the referral should be swift. So we have to connect them to the outpatient clinic. But it has a high satisfactory level. But sometimes it requires a surgery. But some of them are not emergent. So in that case, we cannot let them have the surgery right away. In that case, those patients have to wait, and it could lead to complaints. And sometimes we prescribe medication, and some of the foreign patients want Korean medication, but it is not possible for us to send out those medication to foreign countries. So I hope to see an improvement in the legal system for that.
And I have another question for Ms. Lee for OB-GYN care. You said there could be several reasons for the preference for Korean OB-GYN care. But after the COVID-19 situation and the expansion of the virus, do you still get the growing demand for that, and for which treatment? In the middle of 2020, amid the expansion of the COVID situation, there are some treatments that cannot be postponed. For example, fertility clinic. And if a mother-to-be is too old, then they want to get the treatment as soon as possible, as quickly as possible. So they were asking us about wiring money, and some foreigners couldn't leave the country because of the blockade in the air travel. So we had to take care of them, making sure that they do something to earn their living. And that's part of things that we did for them. And of course, they left safely, for your information. And we also have frozen embryos. The management of frozen embryos is really important. And for example, we keep them for only certain years. And when the expiration year comes, we have to throw them away. And it's impossible, legally impossible, to extend the expiry date. And for high-risk mothers, they really want to use the Korean delivery service. They wanted to come to Korea, but they can't. And we're also getting inquiry about upgrading their quality of life. So I think the new trend, I think that's going to be a new trend too in the future. For example, vaginoplasty and upgrading their life quality. But the problem is that they cannot get visa issued so far, or some people wanted to get an invitation for the visa, and the exemption of isolation is also a key. Yeah, that was the part that we were getting inquiries in. Yes, thank you. I have another question about which country, where do you get the biggest demand in terms of country? Well, I think mostly the same, mostly similar among the near countries like CIS countries, Mongolia, Kazakhstan, Kyrgyzstan, and Vietnam, probably. Vietnam is especially fond of K-pop culture, highly interested. And they really think it's important to get treated well, and like they are important people. And the thing is that we can provide high quality concierge service and we treat them all like they are our family members. And the price is surprisingly, amazingly reasonable compared to the service they get. For example, for the IVF, one round of IVF in the US, you have to pay $15,000, but in Korea, it's only 2 million Korean won. And of course, Singapore can offer the similar service at similar price, but you can't pick gender. In Korea, you can't pick a gender or twins or triplets. But of course, you can do that in Thailand and the US maybe. But China, as I mentioned, changed their policy, so a lot of Chinese patients will come to Korea. Okay, I see. There's some legal limitations, but thank you for your answer. And my questions will continue to Professor Lee.
So when we look at the classification of disease, and have you heard that the Korean disease called Hwatbyung is registered in the classification? So what is the current status of Korean medicine in the world medical field? And in case of foreign patients coming to Korea for Korean medicine, what are the most common diseases do they have? So this is the question for Professor Lee. So you are asking about the recognition level of Korean medicine overseas, and there are many Korean people living in foreign countries. And in case of those Koreans living abroad and Korean people living in Korea, they know very well about Korean medicine. However, other than that, the recognition level is quite low for Korean medicine, and the government and ourselves, and we, the Korean medicine practitioners, ourselves have been aware of this. But the Ministry of Welfare has released the plan to promote Korean medicine in the world. And they included policies, and it will be implemented with the help of the Ministry of Health and Welfare, and activities will be conducted and coordinated. And it is about the second question. Foreign patients come to Korea for Korean medicine, and I can give you two types of institutions. The most common disease is musculoskeletal system disease, and there are many cases of dermatological problems. And musculoskeletal system disease are the most common. But in case of Japanese patients, they have internal medicine related disease. And some of them want to have a medical checkup by using equipment in the Korean medicine. So these are some of the examples. Thank you for the answer.
Where you mentioned that Korea can offer the best quality collaboration between the Western medicine and Korean medicine, but currently there will be a growing demand for wellness, including obesity and beauty and cosmetics, other than the skeletal muscular diseases. So what could be some things that we have to work on? After the COVID, and this doesn't apply to the Korean medicine, but other areas, other sectors too, will get a lot of foreign patients. And generally, Japan, Mongolia, China, Kazakhstan, and the US
accounts for 70% of the incoming patients currently, according to one report. And after the COVID crisis, well, the government is planning to give the exemptions for self-isolation. I think that could be a great incentive, a great motive for the incoming patients. And I think that could be a great motive or a selling point for the foreign patients that long wanted to come to Korea for treatment. And I think there had been a growing demand of 30% amid the COVID crisis. So there could be a lot more after the COVID. And the collaboration of the Western and Korean medicine treatment, we currently have more than 400 Korean medicine hospitals, and they are already, 80% of them are already providing this collaboration treatment system. And I think this will continue to be a selling point for the foreign patients, and revisiting is a really important part. They have to be repetitive customers. They have to come back to Korea, and for it to be possible, programs have to be continuously developed, and effective and good programs to create virtuous cycle. Yes, thank you for the answer. There could be a lot bigger demands after the COVID. And marketing is important, I guess. You have to do the good marketing to raise awareness among possible foreign patients. And then this time, a question about eye care and ophthalmology. My question to Mr. Lee Jong-ho. Regarding the purpose of the foreign patients coming to Korea for eye care, so what is the main disease? What are they coming here for? And the severe diseases like cataract, and or there could be treatment for LASIK. So what is some split between the two?
Myopia, astigmatism, farsightedness requiring vision correction, as well as cataract and presbyopia are the most common cases among international patients. LASIK, SMILE LASIK show the technical prowess of the Korean medical staff. Eye clinics in Korea comply with the global standard to provide medical services, and they have advanced medical equipment. Although it is the same surgery, it is more stable and more satisfactory in Korea. Not only the surgeries, but the medical services in general have a higher satisfaction level among international patients. Eye clinics which have international patients in Korea, most of them have professional consultants who speak foreign languages. When they have international patients from test to surgery, the dedicated staff ensures a smooth communication from appointment, telephone, and SNS consultation. They have a better system compared to other countries' hospitals. When we look at the medical expenses as well, it is reasonable compared to the average global market.
As was mentioned several times previously, after the COVID situation, there will be a growing number of foreign patients coming into Korea. And in that case, what could be some possible concerns or any area for improvement in your opinion?
The precision of medical techniques in Korea is very well known in the world. Especially, vision correction surgery is operated at micrometer unit, but Korea is leading the field. And after COVID-19, people are more interested in safety, and it will continue in the future. As I mentioned before, during the pandemic, there has been a higher confidence level in the medical system of Korea, and the impact is applicable to eye clinic as well. At eye clinic, we use advanced equipment for tests and surgery. So international patients who are interested in safety will prefer Korea. In particular, nowadays everyone is wearing masks, and not only the younger generation but also senior citizens feel uncomfortable wearing glasses. And online lectures and work from home increase the usage of personal computers and electronic devices, so it increased the fatigue level on eyes. That is why in the future there will be a higher number of international patients coming to Korea.
Yes, if that area is complemented, that could bring the satisfaction level of foreign patients coming to Korea. Thank you for your answer, Dr. Lee, and we will move on to preventive medicine, and my question goes to Professor Ko. Preventive medicine strikes us as an area for research or building medical facilities or system rather than a clinical department. And I have no personal memory of interacting with preventive medicine. So what could be some contact point between the patients and preventive medicine?
Prevention is divided into three types. The primary prevention is about identifying the risk factors for a disease and either remove or manage them to improve or maintain the health condition. And one good example is health improvement activity. As I pointed out in my presentation, we identify high-risk target population so that they won't get any diseases. Secondary prevention is about early detection and early treatment. In a traditional medical area, medical checkup could be one example. Recently, in the era of precision medicine, the medical checkup linked with the digital health is really, really important. The tertiary prevention is about treating the patients suffering from a certain disease, and we take care of them so that they can go back to their normal life. So preventive medicine is about meeting or interacting with patients in collaboration with clinical experts or communicating with community people.
Thank you for the answer. I think this question relates to the first question. The preventive medicine reminds us of the vaccination as the first thing. And there are many travel programs for vaccination, but it's more about import and export of vaccines rather than moving the patients. But from the perspective of medical tourism, foreign patients have to come to Korea to get vaccination. So what could be some unique strength to attract foreign patients to come to Korea for a vaccination?
Preventive medicine isn't just about vaccination. Through infectious disease strategy, we pursue comprehensive and organized activities. And the biggest strength that Korea has is 3T strategy: testing, tracing, and treatment. In other words, through quick testing to have a quick diagnosis and trace the patients and block the spread of the disease, and that's part of the quarantine activities. And depending on the severity of the patients, they can be triaged into 3 different levels of treatment centers: community centers, clinic, and a hospital. And the resources must be focused on the more severe conditions. So we have to secure the social safety as a way of resuming the medical tourism in the pandemic era. And from the perspective of preventive medicine, personalized treatment has a genomics-based medical checkup at its core. And this personalized service will become a really important medical area. Korea also has a big strength in this area, and I believe. And in this regard, this area will emerge as an important part in the medical tourism.
In fact, the preventive medicine turned out to be really close to our life, and it was a good opportunity to get to know about it. We have had a panel discussion inviting 5 panelists for the session for the Korean Medical and Wellness Tourism Conference, and thank you very much for your time. And we just covered the 5 new areas selected for medical tourism promotion. And I think it was a time and a valuable opportunity to make us realize how closely these 5 areas penetrate our life. We've been through a lot already, but we have to go a long way to overcome the COVID crisis, and we have to join hands together. Thank you very much to the participants and for those of you joining online, and I really hope to see you on site at the next venues. Thank you.